this is Tatiana Alexis here. Thank you for coming back to my channel. Please subscribe and like and comment. I just want to do more information about current birth control methods. So currently, last week on April 4th, I had the Kyleena placed. Prior, I was using NuvaRing and I had a baby. I had gotten pregnant when I took the NuvaRing out, and currently have a 7-week-old baby. So if you hear me rocking something, that's me rocking his rocker, so I can have some peace for a second. Of course, I didn't have any birth control method during the time that I was pregnant. And once I had my baby, I decided to speak with my midwife, and we discussed. She had a chart that had different contraceptives from least effective to most effective. And with that chart, everything that was least effective, almost to the end, I had either tried or could not use. Please talk to your healthcare provider about the side effects and the different medications before you introduce them to your body and what to look for, so that you are well versed on the benefits and the risks of the things that you're using and that you're placing inside of yourself. So, during my pregnancy, I had suffered from preeclampsia and had pregnancy-induced hypertension, postpartum. So I cannot use certain estrogen-based medications. So I had to use a progesterone-based, which is different hormones that regulate in your body to tell your body basically when to shed your uterine lining. With that, my options were limited. I had tried already the progesterone-based depot. That didn't work for me, so I decided to use an implant, which is an intrauterine implant. It's an IUD. That implant was placed in the office, so I could just give you a general overview of what that situation looked like. And also, while I'm doing that, I'm going to go to the website and read any information that I have about this Kyleena, because I want to include everything in this video so you're well versed in what are the risks and benefits that I found myself from research and what I was also told by my doctor. So my choice to use that, like I said before, was because I couldn't use other estrogen based and other progesterone based. I hadn't had any success with. She chose to use the Kyleena over the Mirena because I'd only had one child, and my cervix, before you have a baby, your cervix is closed. It only opens slightly to have your period, then they'll close again. Once you have a baby, there is an ease with insertion of things such as the IUD. And so what she did was she placed the IUD at my 6-week appointment. We chose the Kyleena because I had one child, and it was easier placed, smaller than the larger Mirena, is my understanding. With that, what I did was, it was basically you position yourself like you're having a pelvic exam, and she will insert, it's like inserting a tampon, but inside, instead of it being a cotton absorptive item, it's the IUD. And she pushed the IUD up in place into my uterus. What we did was got it placed appropriately. She had another colleague come and check to make sure that it was in place, because what it does is your uterus is shaped like a pear, and it is shaped as well, so the widest two parts go at the top, and there's a small part that goes to the bottom, and it just sits inside of your uterus, like an upside down pear, let me say that. At the time with placement, I was on my cycle. I had gotten my cycle at 5 weeks and 3 days postpartum, so it was easier to place. So talk to your provider and see if that's something that they prefer. She preferred that I had it placed then because it would already help her more to get it in, since my cervix was already slightly open due to my cycle being on, which was so uncomfortable. But placed it in. Afterwards, I had to go to ultrasound, which is in the same building, went to ultrasound, and they just made sure that it was placed appropriately. In 4 weeks, May 4th or 5th, I have an appointment for them to, I believe, do another ultrasound to check the placement. I would say that I always suffer from very heavy, very painful periods. But after having a baby, no cramp could take me down now, okay? Because contractions are the worst cramps you will ever have in your life. And they come in waves. It'll intensify, it will go down. It will intensify and go down. So the feelings I felt before when I would cramp during my period, it was nothing now. But the bleeding was still very, very heavy. And once she placed the Kyleena, I had an appointment at 1 o'clock. By about 10 o'clock that night, it stopped. Okay, like I didn't have any more bleeding that day. Now she did tell me in the next 2 weeks after the placement, I would have spotting and bleeding up until a few, 2 to 6 weeks or so. And as it's placed longer, my periods would be shorter and lighter. And I can keep this in place for 5 years. If I choose that I want to have a child, I can have it removed, and then we could go ahead and attempt to have another child. However, currently the plan is let this be a baby-free zone. So with the Kyleena, it's Kyleena-us.com. It is a hormone intrauterine device that releases hormones directly into the uterus. Information that it gives you, it says if you have pelvic infections, get infections easily, or have certain cancers, do not use this. Less than 1% of them, less than 1% of the users get serious pelvic infection called pelvic inflammatory disease. If you have pelvic or stomach pain, if Kyleena comes out, tell your healthcare provider. Pregnancy while using Kyleena is uncommon but can be life-threatening, may result in loss of pregnancy or fertility. Ovarian cysts may occur but usually disappear. Bleeding and spotting may increase in the first 3 to 6 months or remain irregular. Periods over time become shorter, lighter, and may stop. So let me see if I can find the side effects really quick. Common side effects of the Kyleena include, and this is vaginal itching and discharge, ovarian cysts, abdominal pain, pelvic pain, headache or migraine, acne, abdominal cramps, it says breast pain or discomfort, increased vaginal bleeding, depression, and hair loss. It also says abnormally long or heavy periods could also be an issue. Absence of menstrual periods, which it states on the website, and bleeding not related to the period, which she said I would have breakthrough bleeding for some time until my body regulated with this being in place. So again, you can go to Kyleena website, Kyleena-us.com, and look at the information there. You can also get it from your healthcare provider. And again, if you have any questions or any comments, now that I feel like I have reached some level of stability, with some wood I can knock on. Here it is. Okay. I will try to do more updates or just answer questions in the comments if necessary. I am not a licensed practitioner that can prescribe Mirena, but I am a licensed registered nurse. So some of this information I was already privy to, but it's always different when you're experiencing it yourself. So I just want to share what my experience was, because it's always helpful to hear different people express what worked for them, what did not work for them. So again, subscribe, like, comment, and I'll see you on my next video.